Hi, I'm Richard from Nuview. Nuview manufacture a wide range of alcohol-free disinfection products, including soap and foam for cleaning and disinfecting hands, which is the focus of this presentation. This seminar is one of a series on cross-infection control presented by Nuview and covers effective hand hygiene in dental practices. The seminar has 3 objectives, and after this presentation you should 1. Understand why hand hygiene matters. 2. Know how to use personal protective equipment effectively. And 3. Be able to wash and disinfect your hands appropriately. So our first objective is to understand why hand hygiene matters. Though I've given you 5 reasons for getting hand hygiene right, by far the most important of these is to prevent the spread of infection. As you can see from the slide. Other good reasons are 1. To comply with HTM 0105, 2. To protect your hands, 3. To achieve compliance at CQC inspections, 4. To preserve your GDC registration. But, as I've said already, the purpose of effective hand hygiene is infection control, because hand hygiene is the single most important measure for preventing the spread of infection. This is reinforced in HTM 0105, which says that hand hygiene is crucial in preventing the spread of infection and the recontamination of surgical instruments and devices. In order to be able to practice effective hand hygiene, it is vital that you care for and protect your hands. This is particularly important for dental staff because the Health and Safety Executive has identified that dental nurses are 10 times more likely than the rest of the population to develop dermatitis, and dentists are 7 times more likely. There are a number of steps you should take to protect your hands. 1. Make sure you're familiar with the risks of any chemical products you are using and follow COSH guidelines. 2. Try to use products that don't irritate your skin. 3. Dry your hands thoroughly after cleaning them. 4. Use hand cream if necessary to keep your skin moist. And 5. Use personal protective equipment, especially gloves. There are several things you can do to take care of your hands, and many of them are set out as requirements as part of HTM 0105. 1. Keep your nails short and do not wear fake nails or nail polish. Long nails can damage glove integrity and bugs can cling to nail varnish. 2. If you're a smoker, make sure you wash your hands before and after smoking. 3. The only jewellery you're allowed to wear is a wedding band, as engagement rings or other costume jewellery can damage gloves and are difficult to clean, and rings or watches prevent effective hand cleaning. 4. Make sure any cuts or abrasions are covered up with a waterproof dressing to prevent microorganisms entering the bloodstream. 5. Keep your skin moist, using hand creams if necessary, and speak to your doctor if you have any skin conditions. And 6. Dry your hands using disposable paper towels. These are things that CQC will look at when they inspect your practice, and on the next slide you can see examples of practices being picked up for non-conformities. For example, staff wearing long sleeves which prevents effective cleaning up the arms. Nothing below the elbows is a good mantra. The nurse's fingernails were long, which compromised good hand hygiene. The dentist and dental nurse wore jewellery which compromised good infection control. Finally, when looking at examples for practicing good hand hygiene, you can see examples on the next slide of a GDC professional conduct hearing when lack of hand hygiene was one reason for suspending a dental nurse for not maintaining an adequate standard of cross-infection control. I now want to move on to our second learning objective, which emphasises the importance of using personal protective equipment effectively. The practice is required to have an infection control policy that specifies when personal protective equipment should be worn and changed, so it is important that you familiarise yourself with your own practice policy. You must wash your hands before donning personal protective equipment and when you remove it. HTM 0105 also sets out some requirements for using PPE, which you can see on the next slide. Essentially, clinical gloves, aprons and face masks are single-use items that should be disposed of as clinical waste immediately after use. Used PPE should not be worn outside of the treatment area or decontamination room. By contrast, heavy-duty gloves used for decontamination, eye protection and shoes may be reused. It is important to wear gloves during treatment and when cleaning in the surgery, for a number of reasons, as you can see on the next slide. Firstly, to protect hands from organic matter and microorganisms. Second, to protect hands from chemicals that could damage them. Finally, to reduce the risk of cross-contamination between staff and patients. There are a few points to bear in mind about gloves which are also covered on this slide. Make sure they are CE marked, fit you properly and are not powdered. Our third and final objective and the main focus of this seminar is how to wash and disinfect your hands effectively. 1. When we talk about hand hygiene, we're referring to hand washing and hand disinfection. 2. You should make sure you have hand hygiene training every year. 3. Your hand wash basin should have a cleanable poster over it and must be used solely for hand washing. 4. Hands should be washed at the start and end of each session. 5. It's fine to use a hand disinfectant, gel or foam between patients, as long as your hands are not dirty or don't feel sticky, in which case you should wash them. 6. Bar soap and nail brushes should not be used. 7. Bins should be foot or sensor operated, so there's no need to touch them with your hands. There's a whole section in HTM 0105 listing the occasions when you should wash or disinfect your hands. These are shown on the slide. You really have two choices. You can either try to memorise the very long list in section 6.4 of HTM 0105, or you can just get into the habit of washing or disinfecting your hands before or after you do anything, which is what I'd recommend. So how should you wash or disinfect your hands? You can now play the video that demonstrates the correct process. My apologies for the continuity errors, but the video does describe the process very well.
Turn on the water and adjust the temperature. Wet all hand surfaces, including wrists, under running water before applying the hand washing agent. Then wash your hands in the following order. Remember to use friction on all hand surfaces. Rub palms together to create a lather. Rub right hand over back of left with fingers interlaced. Change hands and continue. Rub palms together again with fingers interlaced. Clasp hands and rub back of fingers against opposing palms. Change hands and repeat. Rotate right hand around left thumb. Then rotate left hand around right thumb. Use fingertips to cleanse centre of palms. Rotate right hand around left wrist. Change hands and repeat. Rinse hands and turn off taps using elbows or paper towels. Then shake off excess water and dry your hands thoroughly. The hand washing process should take a minimum of 10 seconds. To summarise, rub palms together to create a lather. Rub right hand over back of left with fingers interlaced. Change hands and repeat. Rub palms together again with fingers interlaced. Clasp hands and rub back of fingers against opposing palms. Change hands and repeat. Rotate right hand around left thumb. Then rotate left hand around right thumb. Use fingertips to cleanse centre of palms. Rotate left hand around right wrist. And finally, rotate right hand around left wrist.
The reason that this process is so important is that research using ultraviolet light test shows that when people don't use the correct hand washing technique, the areas commonly missed and not cleaned effectively are the thumbs, fingertips and webbing. This is why we use the technique shown in the video and summarised in the next slide. You should get into the habit of using this technique not just when you're washing your hands, but also when disinfecting them. As you saw on the video, the whole process can be completed in 10 to 15 seconds. There's no reason not to use the technique, even when using a gel or rub. That concludes this seminar on effective hand hygiene in dental practices. You should now understand why effective hand hygiene matters, know how to use personal protective equipment effectively, and be able to wash and disinfect your hands appropriately. Thank you for taking the time to view this presentation. I hope it proved useful and informative, and please look out for other cross-infection control seminars brought to you by Nuview.